Hi, I'm Dutch Rojas. I'm the founder of Everyone Health. And what we're in the business of doing is helping self-funded employers pay significantly less for healthcare. Now, what does it mean? We're not in the RX business. We're not in the durable medical equipment business. I know, I take your emails, I return your emails, and I respond because I'm nice. But that's not the business we're in. We're in the business of helping patients find transparent, all-inclusive, bundled prices for every single medical treatment that they may have. Now, we generally don't do like oncology or transplant. But if you said, Dutch, what do you do? I'd say we do physician visits, we do CT scans, we do MRIs, we do x-rays, we do mammograms, i.e. radiology. We do lab tests. Lab tests covered 15 billion transactions last year. 15 billion. That's a significant number. So CT tests, radiology, that's another 200 million. Then we cover gastroenterology, most commonly known as upper endoscopies. About 60 million of those occurred last year. And then colonoscopies, about 19 million of those occurred last year. That's significant utilization. Then we pay for PT. We try to find direct prices for PT. And then we do orthopedics. We do interventional pain. We do physical medicine and rehab. We do urology. We do ENT. And if you ask me what ENT really stands for, I really can't even pronounce the name. That's the truth. We also do ophthalmology. We do dermatology. We do basically everything that's a scheduled procedure. Now, what do we do with those things? What we do is we bypass the commercial carriers. Those are the big companies known as the BUCAs, Blue Cross, United, Cigna, and Aetna. And they historically have partnered with health systems that like to overcharge every single person in the country, then put a lien on their house and then make them go bankrupt. That's how I feel about it, but it's also true. So we bypass those carriers and we go directly to the physicians. Physicians are generally in hospitals, surgical hospitals, ambulatory surgery centers, and then in their own independent facilities. Now, what we do is we go directly to them and we ask them for one thing: what is your cash price? And what we found is that cash price is generally 50 to 70% less than what the BUCAs, Blue Cross, United, Cigna, and Aetna, are asking. So why does that work for an employer? Well, if an employer knows what the price is up front, and an employer knows what they're going to pay, now they can budget. We like to call this stabilizing a pro forma. Very simple, and it's what CFOs do every day. They want to know what the price is for pencils. So why wouldn't they want to know what the price is for a colonoscopy? Or what the price is for a physician visit? Or what the price is for a PT visit? Like, it's not really rocket science, but we've made it very difficult. Now, one of the challenges is that healthcare is the second largest lobby in the country. About $150 billion goes to Washington to lobby so that people can charge you, well, really, so they can overcharge you. Now, these are all difficult things to overcome, and they're things that we help self-funded employers fix. We're the solution. Now, what the solutions are, how we implement it, like, that's another video series. But I'm here to tell you, direct contracting, making sure you have transparent prices, and ensuring that you know what you're going to pay is going to be one of the biggest solutions for the challenges facing healthcare. We're everywhere doing everything for everyone at Everyone Health.